Well, hi everybody, it's Nurse Cathy and it's time for 5 on Fridays. Well, it's clear that the COVID waves, they just keep coming, and so they're not going to go away, but that doesn't mean our health and well-being have to be on hold. I keep looking at my calendar and I keep thinking, man, it's so packed and full. What can I, change? What can I get rid of? Well, you know what? There are 5 appointments that you should really consider keeping. Well, the first appointment that you want to consider keeping is your annual wellness exam with your primary care physician and any subsequent checkup routines completed throughout the year. There's a reason why your doctor wants you to come back for those additional appointments. Now, depending on your age and your current health status, your doctor will recommend at least an annual exam. And for those with underlying medical conditions, your doctor may advise follow-ups, say every 2 to 4 times a year. There's a reason for them, so keep those appointments. Now, if you don't have a PCP, contact me and I'll help you locate a physician. Or you can go to myuhc.com. It's a great resource too for locating a premium provider. Now, let's not forget our children. They also need their yearly visits with the pediatrician. You don't want to miss any childhood vaccinations. Now, missing vaccines could lead to the resurgence of some diseases and illnesses such as measles. Now, the second appointment that you don't want to miss is delaying a preventive screening, such as a mammogram, Pap screening, or colorectal screening. Now, it's easy to find an excuse to avoid these procedures. Now, as time goes on, and if a problem does exist, this could mean a poor prognosis for you because the cancer has more time to progress. Now, preventative screenings decreased in 2020 due to COVID, but don't delay in 2021. Discuss with your doctor age-appropriate screenings, and your doctor will help schedule your screenings. Number 3, dental visits. Now, many people have delayed dental care due to the pandemic, even after the dental offices reopened following the shutdown. Now, spotting dental problems early allows for more effective treatment and be more affordable to your pocketbook. You'll probably see your dentist at least twice a year for a checkup and cleaning. Now, if you have more severe dental problems, you may see your dentist more frequently, say maybe every 3 months or so. So, annual dental appointments for children are also important. They should not be missed. For those children with braces, timely adjustments are key to success, so don't miss those appointments. The next appointment that you shouldn't miss is if you've got a scheduled lab draw appointment for a high-risk condition where it also requires medication management. Now, an example would be anticoagulant therapy. Now, if you have a medical condition where there is a fine line between too much or too little of a medication level in your body, keep that appointment. It needs to be monitored. It's too risky to not know. Too little or too much can be life-threatening. And then lastly, your eye exam. Protect your vision and your eye health. An average is generally every 2 to 3 years based on your age and medical history. However, as we age yearly, eye exams may be recommended. Now, especially those with diabetes, a dilated diabetic eye exam should be completed annually to rule out diabetic retinopathy, which could lead to blindness. Now, these are just a few appointments that you don't want to miss or avoid, so keep those appointments. Well, that's all from me. Hope you have a great weekend. Take care.